Welcome to Hot Takes, a series from Red Hot Healthcare that delivers thought leadership to our viewers and listeners in under 12 minutes. There's no softball questions, no sales pitches from our guests, and I'm your host, Steve Ambrose. And today's hot take is from Tibor Merey. Tibor is the managing director and partner at BCG. That's the tech build and design unit at Boston Consulting Group. It has nearly 3,000 technologists, programmers, engineers, and human-centered designers located across 80 different cities. Tibor, welcome to the show, and it's great to have you here. Can you tell the audience a little bit about your background in healthcare?
Thank you so much for having me, Steve. As you said, my name is Tibor, and I'm a managing director and partner at BCG, where I have the privilege to co-lead our global Metaverse and Web3 practice. In that role, I work with clients across industries, including healthcare, and I'm very happy to share our insights on what this means for the healthcare space, not only from some of the 120 projects we did across industries, but also from a very recent survey we did exclusively with healthcare executives.
Let's start first with Meta. Initially, everybody knows about Meta, Facebook turning into Meta, and then Meta came out with its Metaverse and really in many ways flamed out. Flamed out in terms of the use of the Metaverse, how it was approached. Financially, it obviously had a lot of shortfalls happening. So how is the Metaverse for healthcare going to be different in its approach and the offerings that it's going to bring, Tibor?
Excellent point. I think I want to start by reiterating that the metaverse does not equal meta. Yes, Mark Zuckerberg has grand ambitions for his company and also even gone as far as renaming it to Meta, but the metaverse is much more than just a single player. To me, I think the key difference is that Meta's goal is to increase the reach to millions or even billions of people across the planet, and doing so with new means that they see forming part of the metaverse. But when we look at healthcare and how the metaverse does make sense for healthcare professionals today, it boils down essentially to three key benefits. One is also related to increase access to healthcare. So how can this technology help underserved communities or geographies get access to highly qualified healthcare services? The second one is really about delivering better patient outcomes. So how can these technologies augment existing procedures or make procedures possible that were impossible before? And the third key benefit is obviously tackling one of the biggest challenges in healthcare, driving down cost. So as you can see, it's a much more nuanced field of use cases and motivations than just comparing it to the company Meta per se.
Yeah, it's interesting. In many ways, it's almost like that the business case, even though we're dealing with patients, there are real business practicalities to be dealing with that the metaverse can help with really right from the get-go, it sounds like, as opposed to we all get together in one room and start chatting and speaking with each other. Is it more business centered in healthcare on its initial setup? Is that where the difference could be as well?
That's right. And I think, as we maybe look back to previous technology evolutions, we also saw that, for example, with the mobile phone, that started as well on the business side. And why was that? It was because the early mobile phones, the Motorola bricks that some of us were carrying around, they were being used by business people first. And the reason for that was that those were high friction technologies where you had to look for the use cases where the value add outweighed that friction. And we see that only once then the price and the ergonomics of those devices start to improve, that then also the mass adoption started with the mobile phone, which then became the smartphone and had its iPhone moment in 2007. And the same thing is happening now in healthcare. You could very much say that, for example, the topic of VR headsets have the same drawbacks that, let's say, the early mobile phones had. And so we have now a setting where we see pockets, but very real pockets of high ROI, where you can today already deploy these technologies. And as the technology matures and costs come down, that's where we would expect mass adoption also within healthcare and on the patient side happening more widespread.
You bring up ROI. That's a great segue into our next question here that I'm going to ask. And that is, when we look at healthcare companies, life science companies, providers, insurance companies, digital health companies, when we look at companies investing in the metaverse today, where do you see the strongest ROI cases coming out of the gate?
Excellent question. And that was also one of the key questions we asked in our global Metaverse in Healthcare survey. And I think on a general level, there are three core use cases that stick out. One is certainly improved training. And we have heard stories of, for example, surgeons training on virtual bodies before having to cut an actual body, and also other means how you can really drive home better training results using immersive technologies. The second key area is, in general, better quality of care. Augmenting existing care, for example, in psychological care and therapy, or also in ophthalmology. There's a broad range of different treatments that can be augmented by these technologies. And the third key area we see cutting across different types of healthcare providers is to really go into the topic of customer engagement or also patient education. With, for example, a pharma company having devised a patient experience to take patients with a rare blood disease into the inside of a blood vessel, because that disease is so complex that even trained specialist physicians have troubles explaining that to their patients. But once you are inside that, and I had the privilege to be inside that blood vessel, you see really how your disease works. There's the leukocyte, there's the thrombocyte, here is the enzyme. This is how the treatment is working. And for the first time, these patients can really understand what is wrong with them and also how that specific therapy will help them.
Here in the States, we're getting a bigger surge more than ever in what we would call consumerism. Patients that are more empowered with it than ever before about not only their own healthcare, but choices in healthcare. It's no longer the doctor says and they do. It's they can go into Google and there's so many informational sources, Tibor, that they can be empowered by. And we're also seeing retail companies getting into healthcare. Like the traditional players are there, the hospitals, the health systems, but we have new companies coming in that were never set up for healthcare before, and now they're making inroads. Where do you see the metaverse playing a role in this sort of tectonic ground shift that we're seeing in the way that patients are being more empowered, more consumeristic, and maybe how traditional players in healthcare are ceding to new entrants like I mentioned?
This is a very big question, obviously. And I think what we also see happening with the metaverse is oftentimes also an acceleration of existing trends, like you were mentioning, of general digital health or consumerism hitting healthcare as well. And so if I also take a step back, I think we were saying a couple of different also buzzwords to the audience. One was around virtual reality, augmented reality. We have the whole topic of Web3, so the third iteration of the internet being powered by the blockchain. And these different technologies, they have also different benefits and a different interplay with what you mentioned. But if I, for example, take the topic of immersive technology around, for example, VR, augmented reality, I think it does play to the strength not only of new entrants, but actually to the current providers that can now augment the way they treat their patients. But it also is accelerating that softwareization. Things where I used to have where the physician had to have multiple devices in his or her doctor's office suddenly can be put, for example, in the case of ophthalmology, on top of a headset. So that already streamlines the process within the clinic. And from that, it is a very short jump to say, maybe at some point, I get the headset shipped to my home. And I don't even have to go anymore into the doctor's office for that treatment. So that consumerism will not only be, let's say, affecting us on the topic of research or also exploring different types of therapy, but will also go into the actual treatment. And we see that, for example, already happening as well on the psychological and mental health area.
I'd like to get your opinion on what you think some of the biggest misconceptions are about the metaverse that you think are, because there's a lot of misunderstanding out there, holding companies back from investing and really benefiting.
Absolutely, and probably there's not a single other term in the metaverse that gets kind of misunderstood or misused as much as metaverse these days. So, if I would boil it down, I would say the three biggest misconceptions about the metaverse are the following. The first one is people thinking that the metaverse will be one big platform, potentially even be owned by one single player, where everything will happen within that platform. That will not be the case. Similarly, like in our world today, we have public spaces like parks and then closed spaces like offices or discotheques. And some of them are work-related, some of them are entertainment-related. The same thing will happen in the metaverse. So it will be an ecosystem of different types of platforms and spaces. The second big misconception is the topic that everybody thinks you need a headset to access the metaverse. Yes, we have more and more spatial experiences in 3D, like the one I mentioned with, for example, patient education. But by no means it means that you can only access those through a headset. Actually, the biggest entry point, even today, is still through 2D or using your mobile phone to access some of these experiences. And the third big topic that gets often confused is people just mashing together the whole crypto and Web3 topic with metaverse, not differentiating enough. And the way how we delineate the line between Web3 and the metaverse is, yes, Web3 and the blockchain does have overlaps. For example, to have a decentralized way of managing patient data in a more safe and secure way. That has definitely some overlaps with some of the other metaverse use cases. But if you only hold, for example, one Bitcoin in your wallet, that obviously might be considered crypto, but doesn't have anything to do with the metaverse.
Tibor and Merey from BCGX, thanks so much for being with us today here on Hot Takes. Really appreciate you making the time to come in. It was an absolute privilege. Thanks so much.
Thank you so much for having me.
And for those watching and listening, you can pick up every show of Hot Takes by visiting redhothealthcare.com. Thanks for watching and listening in. Have a great rest of your day.